Cardiac arrest. Cardiac arrest is the abrupt loss of heart function in a person who may or may not have been diagnosed with heart disease. It can come on suddenly or in the wake of other symptoms. Cardiac arrest is often fatal if appropriate steps aren't taken immediately. Is a heart attack the same as cardiac arrest? No. The term heart attack is often mistakenly used to describe cardiac arrest. While a heart attack may cause cardiac arrest, the two aren't the same. Heart attacks are caused by a blockage that stops blood flow to the heart. A heart attack refers to death of heart muscle tissue due to the loss of blood supply. It's a circulation problem. A heart attack is quite serious and sometimes fatal. By contrast, cardiac arrest is caused when the heart's electrical system malfunctions. The heart stops beating properly. The heart's pumping function is arrested, or stopped. In cardiac arrest, death can result quickly if proper steps aren't taken immediately. Cardiac arrest may be reversed if CPR is performed and a defibrillator shocks the heart and restores a normal heart rhythm within a few minutes. Cardiac arrest may be caused by irregular heart rhythms called arrhythmias. A common arrhythmia associated with cardiac arrest is ventricular fibrillation. In ventricular fibrillation, the heart's lower chambers suddenly start beating chaotically and don't pump blood. Heart attack and sudden cardiac arrest differences. People often use these terms interchangeably, but they are not synonyms. A heart attack is when blood flow to the heart is blocked, and sudden cardiac arrest is when the heart malfunctions and suddenly stops beating unexpectedly. A heart attack is a circulation problem and sudden cardiac arrest is an electrical problem. What is a heart attack? A heart attack occurs when a blocked artery prevents oxygen-rich blood from reaching a section of the heart. If the blocked artery is not reopened quickly, the part of the heart normally nourished by that artery begins to die. The longer a person goes without treatment, the greater the damage. Symptoms of a heart attack may be immediate and intense. More often, though, symptoms start slowly and persist for hours, days or weeks before a heart attack. Unlike with sudden cardiac arrest, the heart usually does not stop beating during a heart attack. The heart attack symptoms in women can be different than men. What is cardiac arrest?
Sudden cardiac arrest occurs suddenly and often without warning. It is triggered by an electrical malfunction in the heart that causes an irregular heartbeat, arrhythmia. With its pumping action disrupted, the heart cannot pump blood to the brain, lungs, and other organs. Seconds later, a person loses consciousness and has no pulse. Death occurs within minutes if the victim does not receive treatment. Catch the signs early. Don't wait to get help if you experience any of these heart attack warning signs. Some heart attacks are sudden and intense, but most start slowly, with mild pain or discomfort. Pay attention to your body and call 911 if you experience chest discomfort. Most heart attacks involve discomfort in the center of the chest that lasts more than a few minutes, or it may go away and then return. It can feel like uncomfortable pressure, squeezing, fullness, or pain. Discomfort in other areas of the upper body. Symptoms can include pain or discomfort in one or both arms, the back, neck, jaw, or stomach. Shortness of breath. This can occur with or without chest discomfort. Other signs. Other possible signs include breaking out in a cold sweat, nausea, or lightheadedness. Symptoms vary between men and women. As with men, women's most common heart attack symptom is chest pain, angina, or discomfort. But women are somewhat more likely than men to experience some of the other common symptoms, particularly shortness of breath, nausea/vomiting, and back or jaw pain. Heart attack symptoms in women. If you have any of these signs, get to a hospital right away. Uncomfortable pressure, squeezing, fullness or pain in the center of your chest. It lasts more than a few minutes, or goes away and comes back. Pain or discomfort in one or both arms, the back, neck, jaw, or stomach. Shortness of breath with or without chest discomfort. Other signs such as breaking out in a cold sweat, nausea, or lightheadedness. As with men, women's most common heart attack symptom is chest pain or discomfort. But women are somewhat more likely than men to experience some of the other common symptoms, particularly shortness of breath, nausea/vomiting, and back or jaw pain. Understand your risks to prevent a heart attack. Understand the risks you face for heart attack. Extensive research has identified factors that increase a person's risk for coronary heart disease in general and heart attack in particular. The more risk factors you have, and the greater the degree of each risk factor, the higher your chance of developing coronary heart disease, a common term for the buildup of plaque in the heart's arteries that could lead to heart attack. Risk factors fall into three broad categories. Major risk factors. Research has shown that these factors significantly increase the risk of heart and blood vessel, cardiovascular, disease. Modifiable risk factors. Some major risk factors can be modified, treated or controlled through medications or lifestyle change. Contributing risk factors. These factors are associated with increased risk of cardiovascular disease, but their significance and prevalence haven't yet been determined. The American Heart Association recommends focusing on heart disease prevention early in life. To start, assess your risk factors and work to keep them low. The sooner you identify and manage your risk factors, the better your chances of leading a heart-healthy life. The three categories of risk factors are detailed here. Major risk factors that can't be changed. You may be born with certain risk factors that cannot be changed. The more of these risk factors you have, the greater your chance of developing coronary heart disease. Since you can't do anything about these risk factors, it's even more important that you manage your risk factors that can be changed. Increasing age. The majority of people who die of coronary heart disease are 65 or older. While heart attacks can strike people of both sexes in old age, women are at greater risk of dying within a few weeks. Male gender. Men have a greater risk of heart attack than women do, and men have attacks earlier in life. Even after women reach the age of menopause, when women's death rate from heart disease increases, women's risk for heart attack is less than that for men. Heredity, including race. Children of parents with heart disease are more likely to develop heart disease themselves. African Americans have more severe high blood pressure than Caucasians, and a higher risk of heart disease. Heart disease risk is also higher among Mexican Americans, American Indians, Native Hawaiians, and some Asian Americans. This is partly due to higher rates of obesity and diabetes. Most people with a significant family history of heart disease have one or more other risk factors. Just as you can't control your age, sex, and race, you can't control your family history. So, it's even more important to treat and control any other modifiable risk factors you have. Major risk factors you can modify, treat, or control. Tobacco smoke. The risk that smokers will develop coronary heart disease is much higher than that for non-smokers. Cigarette smoking is a powerful independent risk factor for sudden cardiac death in patients with coronary heart disease. Cigarette smoking also interacts with other risk factors to greatly increase the risk for coronary heart disease. Exposure to other people's smoke increases the risk of heart disease even for non-smokers. Learn about smoking and cardiovascular disease. High blood cholesterol. As your blood cholesterol rises, so does your risk of coronary heart disease. When other risk factors, such as high blood pressure and tobacco smoke, are also present, this risk increases even more. A person's cholesterol level is also affected by age, sex, heredity, and diet. Here's the lowdown on total cholesterol. Your total cholesterol score is calculated using the following equation: HDL plus LDL plus 20% of your triglyceride level. Low-density lipoprotein, LDL, cholesterol equals bad cholesterol. A low LDL cholesterol level is considered good for your heart health. However, your LDL number should not be the main factor in guiding treatment to prevent heart attack and stroke, according to the latest guidelines from the American Heart Association. Heart attack types and diagnosis. A heart attack is also called a myocardial infarction, sometimes simply referred to as an MI. A heart attack occurs when a blockage in one or more coronary arteries reduces or stops blood flow to the heart, which starves part of the heart muscle of oxygen. The blood vessel blockage might be complete or partial. A complete blockage of a coronary artery means you suffered a STEMI heart attack, which stands for ST elevation myocardial infarction. A partial blockage translates to an STEMI heart attack, a non-ST elevation myocardial infarction. Diagnostic steps differ for STEMI and STEMI heart attacks, although there can be some overlap. Remember, never try to diagnose yourself. Always contact on emergency if you think you might be having a heart attack. The EMS crew in your ambulance will route you to the right hospital based on your location.